So once again, we're going to be looking at what we started in the 2 previous episodes, the 7 stages of disease progression. Okay, we've looked at the last session, we looked at irritation and we looked at inflammation. Now we're going to be looking at the next one, which is ulceration. Now, unresolved inflammation will lead to the destructions of massive amount of cells and tissues. Now, when tissues are being destroyed, painful holes like ulcers can literally be opened up. Now, for most people, the relentless use of drugs still continues at this point. They are not paying attention. They know they hear what. They are not listening. They are not interested in why is my body giving me these signs. Their own is, as long as they have access to medication, let them just be swallowing the medication and continue in that same lifestyle that has gotten them to this point. So you need to help yourself. Your health is your responsibility, and it requires a lot of discipline, and that price is what you have to pay. Nobody is going to pay that price for you. This is not the situation where like some people will pay people money to fast for them, to pray for them. No, in this case, you're the one. You need to take up responsibility and ask yourself, why am I on this? Why do you think you have to be on medication for the rest of your life? Some people are so indisciplined, they want to continue eating all the wrong foods and keep popping drugs into their body. They tell you, they have indigestion, the food is not digesting, they keep swallowing drugs, swallowing antacids. Meanwhile, you don't want to pause and ask yourself, why is my food not digesting the way it should? So this one is not from the village. This one is not from the sea or what. It's you. You are the one that needs to pause and ask yourself, why am I on medications? Why would any human being, you've been on medication for the past 10, 15 years and you're still thinking it's okay? No, it's not okay. We need to begin to interrogate these things. Yes, it can manage those diseases for you, but at the end of the day, some of them, look at those papers they put inside those drugs. Try and read the adverse effects, because there's no drug that is manufactured that does not have that leaflet inside. So, and when they write those things, they also add the adverse effects of those drugs over prolonged use. Okay, so it's important that you pay attention, because some people, when they get to this point, they are like, no turning back. They just relax and they keep taking. So ulceration is the 5th stage, where at this point a whole lot of connective tissues are beginning to be affected. Now, for example, in about 10% of people with rheumatoid arthritis, they're already at this stage of ulceration. Now, in addition to underlying disease, there's also need for you to pay attention to your lifestyle in general. For example, if you have been on certain drugs for a long time, you need to ask yourself, are there other things I need to look into? Because the reality is this: even a simple deficiency of a certain micronutrient, yes, it's micronutrient, a certain deficiency, prolonged deficiency of certain micronutrients can predispose you to diabetes, can predispose you to high blood pressure, can predispose you to a whole lot of diseases. Now, when you go and run a test, the test will be looking at the symptoms you're having. How many people go to run tests and you tell them, oh, you want to look at your lipid let me even say, you want to look at your metabolic panel, for example. Some of these tests, when you send people to go and run them, or you want tell them to check your homocysteine level, or you tell them to check your lipid profile and all that, they tell you they don't know what you're talking about. So these are tests that you need to encourage your health, your physician to write, so that you can go and run such tests, because some of those tests actually look at the root causes. Are there deficiencies that could be predisposing you to diseases? You don't have to wait and just wait. You know, there's what we call the wait and watch and wait strategy in medicine, where somebody is having headache, they tell the person, oh, okay, don't worry, let's see how this headache progresses. They give you some drugs, you go and come back. Or somebody saw a lump in the breast and they said, no, it's too small, let's wait and see how it progresses. You're on your own. You can't do that. Before that lump even got to that point where you can actually feel that there's a lump in your breast. It's been there for like how many years? So you don't allow anybody to tell you wait till it develops, because by the time it develops, the story will be different. So after ulceration, we move to what we call induration. Induration is a form of scarring. Okay, it is the hardening of tissues, or the filling of tissues where it has been lost, just like in the case of ulcer. So at this point of induration, you can begin to feel certain types of hardness in certain parts of the body, or what we call lumps. For women, it could be lumps in the breast. For some other people, it could be also like fibroids and all that. This is the point of induration. Now, induration is the last stage during which the body is still in control of its cells. Now, should the destructive practices which brought matters to this stage continue, the DNA of the cells can be severely damaged, that the cells can go crazy and stop obeying normal metabolic command. When cells go wild in this manner, it now brings people to that stage where nobody wants to talk about, which is called cancer. Okay, so it's a stage. Cancer, like we all know, is the distal end of an inflammatory process where proximal beginning may be any irritation. It is easy to see that cancer and all chronic diseases were once innocent symptoms that could have been adequately dealt with, but were either ignored or suppressed with drugs time and time again until they developed into a massive problem. So I'm going to stop at this point, because the topic on cancer is a totally different and is very vast. So we're going to stop this. We have looked at the 7 stages of disease progression before you get to this point called cancer, and I'm going to end it here, so that in the subsequent edition, in the subsequent session, we're not going to look at cancer as in, okay, what exactly is cancer? Can it be controlled? Is there anything you can do to prevent it? The answer is yes, it can be controlled. There are things you need to know to do to prevent it. Then, if you have it already, is there hope? Is it treatable? Is it reversible? Is it curable? And the answer is a big yes. Do not fear has torment. Do not allow fear to torment you, to push you into believing that cancer is a death sentence. We always tell people, and we keep reiterating, that cancer is not a death sentence. But remember what I said. You have to believe what God says, because you can only speak when you believe. If you don't believe, the choice is yours. God says, I set before you life and death. Choose life that you may live. Cancer is not a death sentence. So in the next session, we're going to be looking at it in more, we're going to dig deeper, so that you can understand and know how you can prevent this and what you need to do. God bless you.